Hi, I'm Mendel, and I will be demonstrating the restraint skills checkoff. So first thing first is I would check the doctor's orders and the patient's chart to see what I'm doing. For restraints, you have to have a doctor's order, so I can't do it just because I want to. I have to be told by the doctor to do it. So I would gather all my supplies, and I would practice hand hygiene, so I'd wash my hands or do the hand sanitizer if I didn't have to wash. And then I would put on my gloves, just so I don't have to do skin-to-skin contact with the patient. Keep myself safe. So I put those on, and then I'll gather all my materials. So I'll go in the patient's room. Hi, I'm Nurse Marie. Are you Miss Lily Harris? And then she would respond, make sure it's her. I'd ask her for her date of birth just to make sure it is the right patient. And then I'll pull the curtains to provide privacy, make sure nobody is creeping in. And then I will raise the bed, tell her what I'm doing today. Typically, you would only restrain a patient if they were very confused or like yanking at their tubes. So the doctor would give you the order to do it just to protect himself. So I would raise the bed. This is weird. Let's see if it's okay. So I'll take the restraints and unwind it, and then so basically it's like a clip and Velcro. So I would put on a wrist. So the doctor just ordered to do wrist restraints, and we only have one available, so I'm just demonstrating on one wrist, but you do the same thing to the other. So I'd wrap this around with the Velcro, and then I'd clip it, and then I would put 2 fingers in to make sure it's not too tight or too loose. And so the next, I would take this and put it through here, and basically I'm tying it to the bed. I'm not going to tie it to this part because then it could just slide and she would be able to move. So I'm going to tie it around here, and I'm going to be doing a quick release knot so that if needed, I could unpull or untie it really fast. So I would pull this as tight as I need it, and then kind of go through like that. Okay, and then I'm just going to pull her arm up just to show it's not coming undone. It's tight enough. So this knot is really cool because I would just pull it like that to undo it really fast if we needed to do something. And then with restraints, you need to check on your patient every hour just to make sure they're still tied or they didn't get loose or something. And then every 2 hours, you're going to take them off. So I'll just take it off, and you would check for skin integrity and just assess the range of motions and make sure they could do their ADLs, activities of daily living. So I would look at her wrist, make sure she didn't have any like rashes or redness on her wrists from yanking or pulling, make sure her skin integrity is good, make sure she can move her wrist and do the range of motion, and then I could reapply it if necessary. And then, so do that, and then I would ask her if there's anything else I needed to get her, make sure she's okay. I would lower the bed, make sure the call light was within reach, tell her I'd be in shortly, and then I would remove my gloves. So I'll pull them off, and then dispose of them, and then perform hand hygiene, and I would document and chart the patient's name, the date, and what I did, and the integrity of her skin and all that. And so that is how you apply the restraints.